First aid for cats. What every cat owner needs to know. Have you ever wondered what you would do if your cat had an accident at home? It's a scary thought, isn't it? But don't worry. Today, we're going to talk about simple and practical first aid tips for cats that anyone can do at home. Because let's face it, our feline friends love getting into mischief. Imagine this. You're sipping your morning coffee, and suddenly you hear a crash. You find your cat has knocked over a glass vase and cut their paw. What do? Panic is not the answer. Instead, stay calm, and let's go step by step. Safety first. Protecting yourself and your cat, a stressed or injured cat, might react unpredictably. They could scratch or bite out of fear or pain. Wrap your cat in a towel gently but firmly. This keeps them secure and helps you handle the situation. It also makes them feel comforted, like being in a little kitty burrito. Cleaning wounds. Do it right. If your cat has a minor cut, clean it with warm water or a saline solution. Saline is easy to make at home. Just mix 1 teaspoon of salt in a liter of boiled, cooled water. Use a clean cloth or cotton ball to dab the wound gently. Avoid using alcohol or hydrogen peroxide. These can sting and irritate your cat's skin. According to the American Veterinary Medical Association, saline is safe and effective for cleaning minor wounds. Handling heavy bleeding. Don't delay. But what if the cut is bleeding heavily? Stay calm. Apply gentle pressure to the wound with a clean cloth or gauze. Hold it there for several minutes until the bleeding stops. If the bleeding doesn't stop within 10 minutes, it's time to visit the vet. Heavy bleeding could indicate a deeper issue that only a professional can handle. Toxic ingestion. Act quickly. Now let's talk about what to do if your cat swallows something toxic. Maybe they nibbled on a houseplant or licked a cleaning product. Did you know that lilies are highly toxic to cats? Even a tiny amount can cause kidney failure. Other common toxins include chocolate, garlic, and certain essential oils. If you suspect poisoning, don't try to make your cat vomit unless your vet advises it. Instead, call your veterinarian immediately. If possible, bring the packaging or a sample of the substance your cat ingested. Having this information helps your vet act quickly. Burns. Cool it down. Burns are another issue cat owners might face. Imagine your cat jumping onto the kitchen counter while you're cooking. If your cat has a minor burn, cool the area with cold water for a few minutes. Do not apply ice, butter, or any home remedies. Just cool water. Severe burns need immediate veterinary attention. If the fur around the burn is singed or the skin looks raw, it's a sign that the injury might be serious. Choking, stay alert. What about choking? Sometimes cats can get toys, food, or even hairballs stuck in their throats. If your cat is coughing or pawing at their mouth, check for any visible object. If you see something, try to remove it gently with tweezers, but be careful not to push it further down. If your cat is struggling to breathe, go to the vet. Get immediately. Remember, it's always better to let a professional handle severe choking incidents. Be prepared. Build a first aid kit. Now, here's an important question. Do you have a first aid kit for your cat? If not, it's time to make one. Include essentials like sterile gauze, bandages, tweezers, a thermometer, and saline solution. Add your vet's contact information and an emergency number. You might also include an Elizabethan collar to prevent your cat from licking wounds. Keep this kit in an easy-to-reach place. You never know when you might need it. Heat stroke. Keep cool. Let's not forget about heat stroke. Cats can overheat, especially during summer. Signs include panting, drooling, and lethargy. Move your cat to a cool area immediately. Offer them fresh water. You can also wet a cloth with cool water and gently rub it on their paws and belly. Avoid sudden temperature changes, like immersing them in ice-cold water. This can be dangerous. Providing shade and ensuring water is always available are simple preventive steps. Broken bones. Handle with care. Broken bones are another emergency we hope never to face. If your cat is limping or not moving a limb, it could be a fracture. Do not try to set the bone yourself. Instead, keep your cat as still as possible and take them to the vet. Use a flat surface like a board to transport them. The Humane Society suggests this method to minimize pain and prevent further injury. Broken bones are often caused by falls, so securing windows and balconies can prevent these accidents. Eye injuries. Clear the way. Eye injuries are also common in cats. If you notice your cat squinting, pawing at their eye, or if their eye looks red and swollen, act quickly. Gently flush the eye with sterile saline. Do not use any drops meant for humans. If the issue persists, see your vet. Dust, debris, or even playful swipes from another cat can cause eye injuries. Keeping your home clean and monitoring playtime can help avoid such problems. Seizures, stay calm. And what if your cat seems to be having a seizure? This is terrifying but rare. Keep calm and clear the area of anything your cat might hurt themselves on. Do not touch or restrain them. Once the seizure ends, keep them warm and call your vet immediately. Seizures can be caused by toxins, infections, or underlying health conditions. Regular checkups with your vet can help identify potential issues early. Learn CPR, a life-saving skill. Here's a tip that might surprise you. Knowing basic CPR for cats can save lives. If your cat stops breathing, you can try chest compressions and rescue breaths. There are online courses that teach pet CPR step by step. Consider learning it. You never know when this skill might make a difference. Sprains and strains. Handle with care. For instance, have you ever noticed your cat limping after jumping off a high surface? Sometimes they might sprain a joint. In such cases, restrict their movement and apply a cold compress to the area for 10 to 15 minutes. This can help reduce swelling. Always observe their behavior. If the limping persists or worsens, it's a clear sign to consult your vet. Dehydration. Keep them hydrated. Another common issue is dehydration. If your cat is refusing to drink water, pinch the skin on their back gently. If it doesn't snap back quickly, they may be dehydrated. Encourage them to drink by offering fresh, cool water or even wet food. If they're severely dehydrated, they'll need fluids administered by a vet. To prevent this, ensure water is always accessible, especially during warmer months. Adding a water fountain can make drinking more enticing for cats who prefer running water. Bee stings and insect bites. Quick action matters. Cats love chasing bugs, but sometimes this curiosity leads to a painful sting. If you notice swelling or excessive licking of a specific spot, it might be an insect sting. Look for the stinger and remove it gently with tweezers. Apply a cold compress to reduce swelling. If the swelling spreads or your cat shows signs of an allergic reaction, like difficulty breathing, seek veterinary help immediately. Frostbite. Protect against the cold. In colder climates, cats exposed to freezing temperatures can develop frostbite on their ears, paws, or tails. If this happens, never rub the affected area. Instead, warm it gently with a soft cloth soaked in lukewarm water. Keep your cat warm and get them to a vet as soon as possible. Preventing frostbite is simple. Always ensure your cat has a warm shelter during cold weather. Foreign objects. Stay watchful. Consider the dangers of foreign objects stuck in their fur or paws. Sometimes, outdoor cats might come home with burrs or sharp objects tangled in their fur. Carefully remove these with a comb or tweezers to avoid skin irritation or infection. For paw injuries, cleaning the area and checking for splinters is crucial. You can apply a small amount of pet-safe antiseptic cream if necessary. Prevention, the best medicine. Finally, let's discuss preventing accidents altogether. Cat-proofing your home is one of the best ways to avoid emergencies. Secure electrical cords, keep hazardous substances out of reach, and ensure windows and balconies are safe. Even something as simple as keeping sharp objects away from countertops can save you from a stressful situation. Care and preparation. Remember, first aid is not a replacement for veterinary care. It's a temporary measure to stabilize your cat until professional help is available. Always follow up with your vet after an emergency. Taking proactive steps, like learning CPR or preparing a first aid kit, shows how much you care about your cat's well-being. Our cats bring us so much joy, don't they? Taking the time to prepare for emergencies is just one way we can show them how much we care. So, what about you? Do you have a first aid kit ready? Have you ever faced a cat emergency? Share your experiences in the comments below. We'd love to hear from you. And don't forget to hit the like button if you found these tips helpful. Subscribe to our channel for more cat care tips. Because at Cats Know How, we're here to make your cat's life, and yours, a little better every day.